President Obama has proclaimed this week Prescription Opioid and Heroin Epidemic Awareness Week. Painkillers and heroin accounted for nearly 60% of the drug deaths in Minnesota last year. The Hazelden Betty Ford Foundation has created a new program to combat the opioid heroin epidemic. And joining us right now is Mark Mishek. He is the president and CEO of Hazelden. Thank you so much for being here.
Thank you, Esme.
All right, tell us about this new program, because obviously I think all of us are profoundly aware of how big this problem is.
We have a program, it's called CORE, Comprehensive Opioid Reduction Program. 12 reflects the 12 steps of Alcoholics Anonymous and 12-step programs, because in the end it's an abstinence-based program, but it's called the CORE 12 program. We started this program about 2 years ago as a pilot program. And what led us to do it was we were seeing more and more. It was alarming about 4 years ago, 3.5 years ago, as people left our care and went back into their communities, they were dying. They were overdosing on opioids, whether it was pain pills or heroin, something we had never seen before. And so we started to take a really close look at it, and we found that the rise of the use of prescription pain pills and heroin was starting to go through the roof, and that the clinical models that we were using weren't quite touching this. So we had to revamp our clinical programming and really focus on these patients, because being addicted to an opioid, whether it's heroin or a prescription pain pill, is a very tough addiction, and it takes a long time to get well.
All right, and have you had success with it? I mean, because the recidivism rate is enormous for many people.
Well, the relapse rate, we call it, is high. If you simply put them through a quick, let's say, 3-week program, or if you just give them the medications that are available, you have to stay with them for a long time, probably 18 months to 2 years. You need to have them in some level of care as we transition them from really intense clinical care to ultimately we call self-care, self-management of the disease. And that takes a long time to do. And this program allows us to do it using FDA-approved medications, which are very effective for the treatment of the disease during this period of time. Lots of group therapy, lots of group work, lots of fellowship, and a lot of insight that has to happen over that period of time. And yes, our outcomes are good. We are seeing a definite increase in the number of people that are staying sober longer.
Okay, let's talk about access to care, though, because I'm sure there are people listening here who say, I would love to be able to have my loved one go to Hazelden, and how fabulous it is, but they can't afford it, or their insurance doesn't cover it. What about those people? Because that's an enormous number.
Well, a couple of answers. First of all, their insurance should cover it. We have what's called the Parity Act. So in Minnesota, for sure, all the plans cover addiction treatment. All of them do. And we're in network with all of the major plans in Minnesota and around the country. And it's one of the good things about the Affordable Care Act that came by was, number one, young adults could stay on their parents' insurance till age 26. That really helps treatment of young adults. And number two, with the exchanges and with the requirement that everyone carry insurance, the uninsurance rate in Minnesota is under 5% right now, and that's wonderful. So when somebody says they don't have insurance, I tell them to look deeper, look further. Their plan should cover them. Number two, for example, we offer scholarships. We offer patient aid. We really try to get people in and get the care that they need. And number three, we're really expanding our efforts in outpatient, which is a cheaper form of treatment and is very effective.
You know, I mean, most people I know have been prescribed an opioid, including myself, but no one ever told me you could potentially be one of these people that becomes addicted to this. Are doctors getting the message? I mean, do doctors have a responsibility here?
Well, doctors have a huge responsibility for this crisis. The enlightened, good doctors understand that and are starting to take steps. But it starts all the way back in medical school, unfortunately. Most doctors literally get 1 hour of education just about addiction in general, not to even speak of how you engage in safe prescribing practices for opioids. So they come into practice not really understanding what they're dealing with. So it's really important that doctors understand that much of this flows through their pen when they write the script for them, and they need to take responsibility for part of what's going on here.
All right. Well, Mark Mishek from the Hazelden Betty Ford Foundation, thank you so much for coming in.
Now, thank you for having me, Esme. Appreciate it.